are you?
I'm Christopher Lochin. I'm from Toronto, Canada, and I'm about to become a manual osteopath.
Why are you here sitting in front of my camera today?
I've been a registered massage therapist for about 7 years, and throughout that journey, I've seen a lot of clients who have chronic pain issues. Chronic pain being the number one reason I got into the field of rehab in the first place. Starting the journey as a massage therapist with a background in psychology and biology, I wanted to bridge the gap between the mind and the body. I wanted to bridge the gap between trauma and the fascia, the psychology and the behavior, and create a better understanding for myself to help others with their long-standing pain issues.
Did massage therapy do that for you?
As a massage therapist, I often felt like I would put my best effort in and get great outcomes, but there was something missing. There was some element of the practice that felt a little bit constrained. Part of it may be to do with client expectation. Sometimes when you see a massage therapist, you may be expecting just a massage. Sometimes when you see a massage therapist, you're getting a lot more than that. And I started to come to a point where I wanted to offer more. I wanted to offer a more holistic healing service where I can help people with all kinds of organ, fascia, adhesions, pain, mobility. I wanted to add to my toolkit. I wanted to become a better therapist. Thinking about it as manual therapy, thinking about it as body work, and not just massage, this is what kind of led me down this path.
What is this path?
So the path I'm on now, I'm looking at manual therapy as an osteopath, a manual osteopath. And to become a practitioner of manual osteopathy, I'm engaged in a full-time school program. And this is the next step for me. This path is going to allow me to do more with my hands, to have a bigger toolkit and offer more services to the public to relieve their pain.
How did you decide what school you were going to attend?
One of the big deciding factors for me to attend the National Academy of Osteopathy was the fact that they deliver the program part-time online, full-time online, and you can go in person for the technique training and do your theory courses from home. So it allows the flexibility for a professional to create a schedule that fits their needs, not having to show up in person every single day. Other osteopath programs I've seen can take 3 to 5 years to complete. So I decided to choose the National Academy of Osteopathy because they have a condensed version of the program. While it is intense and while it is condensed, I believe that that's the best way to learn for my learning style. Some of the other options in Ontario would have you attending classes with a much lower frequency, more time between classes, more time to forget things. So I saw it as an opportunity to dive head first. And by diving in head first and getting deep into the program right away, within the first week I'm learning techniques, I'm learning things that I can add to my practice as a manual therapist. And I think the delivery, the format of the delivery was the biggest deciding factor for me, aside from reputation of the school. When I was getting ready for school in the morning, it was tough because I had to get to York University Heights. And the York University Heights campus is, it's about an hour and a half on the subway away from here. So, you know, just having that travel time at the beginning and end of the day, it's like 3 hours on transit every day. And, you know, I would pretty much get up and I would just have a banana and then I would go have some coffee, and pretty much that was it. I would be in class for a good, 8 hours. We'd go for a coffee break again, come home, I would crash, have a big dinner and just go to bed, rinse and repeat. And so it was a bit of like a boot camp training of like, okay, I'm waking up, I'm getting ready for class, I'm showing up at class, I'm performing for 8 hours, 5 days a week. And that was 2 weeks, so 80 hours of just putting in that hands-on learning time. It was a little exhausting to be back in a learning environment where you're doing hands-on learning, so you're on your feet, and you're taking in new information at the same time. You're trying to process that new information, and you're on your feet trying to perform that action. So it's not just the theoretical component you're trying to absorb, it's also the practical application. It's a lot, and it was an exhausting process to say the least, but we felt like we really got our money's worth out of the program, and like we came out on top at the end. I really feel like I got a lot of value out of the education. It changed the way I practice manual therapy, and changed the way I look at the body and healing as a whole. So I'm grateful for it, to say the least.
You mentioned that this school is very suitable for your learning style. What is your learning style?
So my learning style is a little bit more visual and a little bit more kinesthetic. For me, being in the first couple of weeks of class, learning techniques right away, I want to practice them. There's a quote from Bruce Lee that rings a bell with me for sure. He says, "I fear not the man that practiced 10,000 kicks, but the man that practiced one kick 10,000 times." And I'm a big believer that repetition and executing these techniques with your hands creates that skill and that memory and that practice that people can feel the experience when you work with them. So a big part of my learning style is to get hands-on as soon as possible. By doing the course in the way I'm doing it, in the second week, I'm already practicing things in internship hours that I learned a bit of in massage school. We get a good module of joint mobilization, but the joint mobilization techniques I'm learning now are more in-depth, more variety, and add to my toolkit. So having that learning style of a kinesthetic learner and being able to practice things right away was a huge decision for me, and it makes a big difference, makes a big impact in my learning experience. So this is where I studied osteopathy. And I'm just going to take you to where I ended up working a lot of the time. So, we had a lot of demos where, we'd all gather around and watch as the instructor would kind of go through the techniques. And then we would partner up and just each kind of practice with each other. And that was a great learning environment. It was very easy to ask questions. It was very easy to kind of figure out what are these little missing links. And, question and answer period ended up being a lot of good discussions for us and a lot of good learning moments. So this is around the area where I sat. And it brings back good memories.
Which of these two words best describes your decision to go back to school? Apprehension or excitement? And tell me why.
Part of my decision to go back to school triggers a bit of apprehension. And part of that is related to life circumstances. In the last year, I moved a couple of times in the last year, 3 times in the last calendar year. I had my practice locations change a few times in the last few calendar years. I had a sense of stability. I felt like I was coasting a little bit as a massage therapist, and having that career change to become a manual osteopath, it's a big decision, and part of the apprehension is not knowing that this is the right thing, but feeling that it is, thinking that it is. The apprehension may be towards the feeling of not having a full-time job, going from working full-time for the last 7 years to being a student again. I also feel like there's a bit of excitement in the sense that I feel like I'm completing a cycle where I started as a student, became experienced, and now I'm becoming a student again, and fulfilling that cycle of learning, gaining some mastery. Not to say I'm a master of massage, but over the time that I've spent learning and practicing, I felt that it was time for things to come full circle. We're on the way to the National Academy of Osteopathy. It's at the York University Heights campus. And we're just gonna go for a quick tour of the school. So actually, during the first week of the in-person training at the National Academy of Osteopathy, I was around all these health conscious people. I was around, my classmates were all physiotherapists and personal trainers, and kinesiologists and massage therapists and family physicians even. There was a wide variety of healthcare practitioners I was working with. And you know, we're entering a healthcare profession as manual osteopathy is also, you know, in that same realm of like health and wellness. I actually felt like kind of weird being someone that I use cannabis regularly, and you know, I'd been reducing it, and like I use it for a little bit of like just help with sleeping, stuff like that. But I also I was using nicotine frequently, and so I was using the vapes. So you know, over the first day, I remember I consciously decided, okay, I'm not gonna vape today. I'm gonna vape in the morning, I'm gonna vape after, but while I'm in class, I'm not gonna vape. I don't want anyone to know. It's kind of embarrassing, you know, being a healthcare practitioner. You don't wanna have bad habits yourself that maybe, I don't know, it kind of contradicts your health profession, you know? So I was doing my best to just not vape that day. I did pretty good. Then the next day I did the same thing. And then by the third or fourth day, one of my buddies had come to my place and we're just hanging out a bit. He's like, he just threw the thing out. And, you know, to be honest, I'm grateful for that because I didn't buy another one since. So it was kind of the third day or fourth day of my training. And I started to get withdrawal. I started to feel kind of sick. It was more of like a nausea and like lightheadedness, those kind of experiences. Mostly nausea, lightheadedness, feeling just a little off, feeling like a little bit of tunnel vision, just these weird kind of feeling off. And I would say after the second or third day of not using any nicotine, I felt fine. I felt a little bit back to baseline, and you know, I'm really happy that I made that decision to quit using nicotine. I'm happy that my friend kind of, you know, was the extra push to do that by throwing out my vape. But it's almost like I'm grateful for that experience to be in a room full of very health conscious healthcare providers. And you know, you are kind of the average of the people you're around. You are the average of the 5 people you hang around the most, but also you are the average of kind of the communities that you're putting yourself into. And I wanted to kind of embrace that, okay, I'm a healthcare practitioner, let's get as healthy as I can get too. And you know, that was a good experience for me. I've spent a lot of time in my career mentoring other massage therapists, acting as a lead trainer, professional development manager, an instructor for Canadian College of Massage and Hydrotherapy. Having these experiences, I feel early in my career, kind of fast forwarded my career. It kind of made me feel and made me grow in different ways that now there's a bit more excitement to become a student again and for that to come full circle. And now I'm in the learning mode again. I'm in the learning seat. I'm the one that is focused on absorbing rather than sharing. So we're just here at the National Academy of Osteopathy in Toronto, Canada. I'm just going to take you guys into the classes. So my favorite class at the National Academy of Osteopathy during my osteopathy education was probably visceral manipulation. And I'm going to tell you why. So with visceral manipulation, we learned how to relate musculoskeletal pain to the organ function. And we learned how to physically manipulate some of the structures, like the connection between the stomach and the intestines, like these junctions where the stomach, if it's not emptying properly into the small intestine, you could have acid reflux, or you could have any number of symptoms based on that. And you can physically manipulate these structures with your hands and enhance their ability of the organ to move. And that movement of the organ can then have a ripple effect of the organ functions better, and then you don't have that same symptom pattern that you were having before. So one of the cool eye-opening ones for me in my practice was I had a client who he had labrum tear in his hip. So that's the cartilage on the inside of the hip. He had damaged, MRI'd. He had it worked on by an orthopedic surgeon, and he was still having hip pain. and we treated his QL, we treated his TFL muscles, we did a lot of soft tissue work, we did a lot of hip mobilization, we got him stronger, we did strengthening, but he was still having hip pain, and I had been seeing him for about 3 years. One of the big eye-opening moments was the week after I did my visceral manipulation modules at the National Academy of Osteopathy. I treated him the following week, and I treated him with the intention of trying to loosen the connective tissue between his kidneys, his QL, and his psoas. So we could go look at the anatomy chart, or even I'll show you on the skeleton right now. So I'm gonna show you on the skeleton the relation between these structures, and this isn't something I had previously ever thought about. So the psoas runs from the vertebra on the lumbar spine into the lesser trochanter here, and the psoas will lift the femur up by pulling basically from here to here, right? The QL will hike the hip up by pulling from these ribs and these vertebra here to this whole crest here. So you have two structures from here to here, and what sits in the middle between my hands, your kidneys sit. So when you do dissectional anatomy, we look at, I looked at this in the cadaver lab before, you can see that the connective tissue around the kidneys, what holds the kidneys and suspends them in place, all of that tissue is continuous with the QL and continuous with the psoas in the fascial line. His kidney was stuck upward. I'm not sure why. After treating him, he had less pain when I mobilized his kidney all the way in his hip. Because of that continuous fascia, something could be stuck along the way, you mobilize it, and then the other ends have relief. And that was eye-opening for me. Before I was targeting his hip as, oh, it's just a hip issue. Oh, it's the cartilage in his hip is just irritating the tissue around it, it's inflamed, the muscles are shutting off. I treated it like that, kind of simplistically, looking at it as a one-dimensional problem. But when I started to look at it in a more three-dimensional way, because of the osteopathic training that I received, I was able to actually solve his hip pain and get a longer result out of the treatment. So it was those moments of those aha moments where you integrate the musculoskeletal with the visceral. Those were the big moments for me, and that's why visceral was my favorite course. And when it comes time that cycle comes to completion again, and I'm feeling like I've advanced myself enough that I want to share the knowledge, I'm excited for what I can provide as a teacher and as an instructor in other settings in the future and what can come of that. So when we're palpating the kidneys, what we're going to do is we're going to go look for the lumbar spine, and then you're going to go just to the bottom rib. You're going to go in that soft spot just below the bottom rib. And then I'm going to put my other hand on top, and I'm going to try to sink in a little bit and almost kind of sandwich the kidney and try to get a sense for where it's sitting. And so I'm in, like, you know that soft spot on your low back where there's very little muscle tissue under your rib? I'm kind of sinking in a little bit there, but I'm just doing it softly, and I'm trying to let it sink in at the pace his body lets me, so I'm not just poking my way in there. So it's going to take a few seconds and a few breaths to kind of get to the dense tissue. The kidney is a little denser than the tissue around it, so I'm looking for that kind of dense feel. You feel that there? That's going to be what I'm looking for right there. And then so once I have that contact, I can kind of feel how dense it is, how it moves, and I'm just doing gentle tissue glides in various directions to kind of see, oh, does that tissue not like to move up? Does it not like to move down? Does it not like to move laterally or medially? And it should be kind of okay to move up and down. Kidneys should be able to move up and down. Every step you take, your kidneys go up and down. So that's a common restriction pattern would be, it would be stuck down or stuck up and not moving enough in those directions. Once I get a sense for it, what I'm gonna do is I'm gonna ask you to come towards me a bit. So I want your hip at almost the edge of the table, a little bit more, that's perfect. And I'm just gonna bring this leg off. And so this is one of the first releases I like to do. What you're gonna do with this arm is you're gonna pump it up and around like that. And you're gonna repeat that several times. Okay. I'll tell you when to start. I'm gonna get a good contact before I get you to move your arm, okay? So then then I'm using the heel of my hand and then my fingertips on the other side. And I'm just dragging up a little bit, and then I'm gonna get you to move your arm now. You feel that open up there? Good. You can move even slower if you want to. So you can come back. I'm just gonna let my fingers rest. You hear your stomach going. Little sounds, little liquid moving, little fluid movement is always good. When I'm working on someone's viscera, I can sense like movement in the other organs and movement and kind of liquid bubbling and things like that. I always think it's a good thing. We're getting things moving, right? And so some of this treatment, although I'm treating with the intention of getting the kidneys, I'm likely getting a little bit of the intestines. I'm likely getting a little bit of, because I'm on your left side, I'm getting a little bit of your stomach maybe. I'm not only treating your kidney, it's a globalized treatment, but we're focusing on that pathway the kidney sits in by putting a psoas stretch and then contacting the kidney. The other one I like to do is you're gonna turn that way. And so this one, I'm gonna bend this knee up a bit. And you're gonna bend this knee up. And what I'm gonna do is I'm gonna contact, and then once I have a good contact, you're gonna kick this leg all the way back as far as you can get it, and then bring it up as high as you can get it once I get a good contact, okay? Okay. So for this one, what I'm gonna be treating is a little bit more of the space between the pelvis and the ribs to start. So it's gonna open up that space. Go ahead. And then you're gonna kick back. And so we're getting a little bit of fascia release at the same time. We're getting a little bit of oblique and abdominal fascia release. We're getting a little bit of fascia release along the iliac crest. And this is also preparatory for the next technique where I'm gonna go a little deeper into the kidney plane. You feel okay with that? And then you're gonna relax. And now I'm gonna contact a bit more of his kidney. And so what I'm doing is I'm gonna anchor that tissue upward a little bit, and then you're gonna kick back again. And then you can even do the arm pump on this side. And then come back with both of them. Good. Yep, you're good. And then you can go back up. And then come back down. And I'm gonna adjust where I'm holding. Go again. And so I spent maybe 10-15 minutes with that patient I was telling you about doing this technique, and his hip pain went away. And it had been like 3 weeks before he called me again.
What do your colleagues and family think of the new route that you're going?
My colleagues were extremely supportive. Although they were a little bit sad, it's a bittersweet experience, I think, for everyone. I'm leaving behind over 40 RMTs that I've worked with as a professional development manager in my other company. I'm leaving behind a big team, and I'm grateful for the opportunity. I'm grateful for everyone's well wishes. I've had a number of people reach out to me and text me saying they wish me the best, and I've had a lot of emails from people saying they wish me the best, and it's been a great experience to receive that kind of those kind of kind words of encouragement from the staff that I've worked with. You know, one of the interesting little transitions from doing the online portion of the program, I had to wake up at around 6 a.m., you know, get used to waking up early again. And during the online portion of the program, I took time off work pretty much completely. I was just treating a few clients with just as a manual therapist, just treating a few cash paying clients on the side. But my schedule was a little bit all over the place. I would kind of wake up, study when it was convenient, book a few clients when it was convenient, and the 2-week intensive of like, okay, I gotta wake up at 6 a.m., show up at the campus and perform to the best of my ability for 8 hours, kind of was a good shock to the system to get me back in the cycle of, full-time work and full-time education and regulate my schedule a bit. And so, it was a gift and a curse, waking up early, 6 a.m., a little bit early for a lot of people, but it was a gift and a curse because it really helped me normalize my schedule going back into the workforce coming in the following month. So, I was grateful for it. Who else did you ask?
Family.
Family. So my family's extremely supportive in this endeavor. My parents have always pushed me to go back to school and educate myself more and become more and more of an expert and specialize more and more in the things that are important to me. My mom is very supportive. My dad is very supportive. I feel like my parents are proud of me. But having support from my parents has been important for me, because part of why I became a massage therapist in the first place, part of why I got into chronic pain care and worked in chronic pain centers and worked in these kind of environments where I'm helping people with long-term pain issues. A big inspiration for me was actually my mother, and watching my mother experience chronic pain at a young age. My mother had an accident where she fell down the stairs when I was about 2 years old. She fractured her 8th thoracic vertebrae, and she was receiving different chiropractic, massage therapy, physiotherapy when I was very, very young. I remember walking on my mom's back when I was just a couple of years old. I remember cracking my mom's back with my feet and kind of doing massage on her shoulder blades and her upper back by walking on it when I was just barely even able to walk, up until I became too heavy for that as you get older. Having that experience, I think, left some kind of imprint where there was a positive association that I developed with providing a favor for someone where you can help them with pain. As my mom would ask me like, hey, do me a favor, can you walk on my back? I would do it. She would feel much better after. She would be more active. She would be able to walk around. She'd be able to do the normal things she wants to do instead of laying down and feeling pain. So I think not having a full understanding of what exactly the benefit was and what exactly I was doing at that age, I still had some appreciation for the fact that, oh, mom is doing better, mom feels good after this. You want to lay on your side facing me? I have your consent, right? Sorry? I don't think you'll need one. Do you need one now? Once I rotated your torso, you're okay, right? Bad, right? So I'm just getting your ilium here. Pressure's okay with you? I like this one a lot, where you kind of rotate you, and then I'm going to hold one vertebra and push the other one adjacent. Have you used this technique before? It's a good one. People like this one. Yeah, so then I'll just go up. You're going to reach forward. And if you need to hold this, you can. You might not need to, it depends how tight you are, and we'll see. I'm gonna do it as stretch and a move. Deep breath in, deep breath out. And then you can gently pull into my hand with your right knee. Yeah, exactly. Just gently lifting and then relax. You feel that for the psoas and rectus femoris. Then you're gonna gently lift into my hand again. And you're gonna relax. Okay, like this. Should I go a little deeper? Yeah, right? Just a little bit. And then deep breath in. And relax fully. I did full-time 6 month because I was an RMT for 7 years, so I have prerequisites or exclusion. You okay? Right side tighter. I'm just doing it a little faster because I'm not quite doing the catwalk yet. I was just kind of feeling the muscle tissue. I was just kind of poking around to see what I feel first. That's all good.
When are you going to be finished with this new schooling?
So the education process and graduation should be wrapped up by the end of August. I should be applying for licensing with the COMPO and the RMO to become licensed to provide manual osteopathic care, and that will be sometime in the fall, as soon as September. So here we have like some of the good anatomy diagrams, you know, like I like this one. They show kind of like normal posture, lordosis, severe lordosis, flat back, but it helps you envision where the pelvis is, where the spine is in relation. This is one of the lead instructors I learned from. This is Dr. Karami.
Hi.
Dr. Karami, how was I as a student?
He was wonderful actually because he has a good background with healthcare.
I used to be a massage therapist.
Massage therapist, yeah. And he has a good knowledge of anatomy and how to do on the soft tissue, and he helped a lot to other students too.
Yeah, like we had a lot of technique sharing sessions after class where it'd be like we'd be here till 5 p.m. some days, just sharing techniques with each other and small groups after the lessons were over. And I really enjoyed that, and it's that community building and that kind of community for osteopaths to kind of get together and share their techniques that I really appreciated, especially about the program too. I was meeting physiotherapists and meeting kinesiologists, meeting other massage therapists, people who had diverse backgrounds, and we were just kind of all putting our minds together on Dr. Kharami might show a technique and say, you know what, we find this is very effective for patients experiencing this. And then all of a sudden we're in a brainstorm session on, oh, what else is good for concussions? What else is good for sciatica? What else is good for this? And then everybody's putting their 2 cents in. And that's the kind of learning environment that I value, where everybody can kind of contribute to a greater sum of knowledge than what we would have achieved if we were just studying by ourselves.
How do you feel about taking us on this journey with you?
It's exciting to have the team at Massage Therapy Media in my corner, documenting this experience, and it's exciting for me to share with the world what osteopathy is. Everybody knows what a massage is, everybody knows what chiropractic is. A lot of people know what acupuncture is, physical therapy, but I think osteopathy is an up-and-coming profession that people have less knowledge about, people have less experience with, and I just want to spread the word and share I just want to spread the word and share kind of the difference between osteopath and other professions and show the potential that this field has to become one of the main services people utilize for pain relief services and healing in general. As a healing modality, I believe osteopathic care can help the body enter that parasympathetic mode where you start to relax, you have the rest and digest, just the way a massage would. I believe that the practice can have the same postural and alignment correction and help people support their bodies and move better in the world the way chiropractic and physiotherapy would. But the edge that I believe osteopaths have, manual osteopaths have, is having that scope and that breadth and the ability to see kind of the bigger picture of how the body is working as an entire unit, rather than seeing the individual parts that are not working well. So I just finished my manual osteopathy education a couple of weeks ago. I had my graduation ceremony, which was a great moment for me and my family. A couple of friends came too, and we had a celebratory dinner afterwards. It was a great moment to just kind of reflect on what the past period of education has been like, and just kind of reflect on the growth over that last period. One of the big learning moments for me was some of the outside of the box ways of thinking about your health and how the health systems and the different organs interact together to produce well-being. It was a real big picture. There was a few aha moments for me, and I want to take you back to the school and show you where some of those aha moments happened.
So Kevin, what is it that made you first seek manual therapy?
Well, what happened with my body was I've been an athlete my whole life, ever since a kid. And then I ran a Spartan race, about an 8-mile race. And I was like 23 at the time. I'm 29 now. And the next day I completed the race, but the next day I couldn't walk. And then I was like really suffering. I was in a lot of discomfort and pain, trying to figure out what was wrong with me.
Where did you have pain?
I had my pain like right on my hip. I couldn't walk.
And what did you find out when you ended up going to the doctors for it?
So I went to go see a sports medicine doctor, and he told me to my face, he's like, you have a permanent injury. And I was like in shock. I was like, permanent injury? Like, what are you talking about? He's like, you have a labrum tear and you have a FAI hip injury. And then this was very puzzling to me. So I did a lot of research, right? And I tried to get massages. He's like, you need hip surgery to fix this problem. We need to shave down your bone because it's sharp, stabbing your ligament.
Mm.
So I had to go through those trials and tribulations that I went through in my life.
And so after your surgery, maybe a few years had passed, and then you ended up contacting me to start doing some manual therapy.
Definitely.
So that was about 4 years ago.
Yeah.
What was your pain like at that time?
My pain was, when I'm thinking about it, it was very hard, man. Like, I was suffering a lot inside, and you got to see that, you know? Like, you see me cry, you see me struggle. I couldn't even, like, squat. I was scared. I was traumatized to squat. I was scared to do ATG split squats. I was scared to do physiotherapy. And I'm very happy that I met you, because you gave me a lot of my confidence back.
What kind of hands-on treatments did we start with that you found helpful? Like, that was different? Like, other than regular massage, what was different about the approach?
You do so much different things. I feel like every time I get a massage from you, you're always doing different techniques, and you're always learning. Like, with the adhesion stuff that you've been learning and implementing on my treatments, it's been really taking me to the next level of my recovery. But you, like, twist and turn me, and, like, hey, like, put pressure against me, and, like, resist me, and, like, let it go. You're, like, really checking the muscles to see what's weak and what's bothering me and the misalignments that I'm having. And then you're giving me rehabilitation, like, exercises to correct myself so I can progress onto my next recovery, you know, so I can be better.
And so over the last 4 years, what other therapies have you done?
I've done so much. I'm really trying to get my body back into, I would say, homeostasis and balance, and really focus on my inflammation levels, right? So I've done, one of the first things I researched was platelet-rich plasma, which is in terms PRP, right? So I've gotten that maybe 6 times, right? And I wish I was fortunate enough I can afford stem cells, but I couldn't. But instead of that, I got something called platelet lysate, and that's pure growth factors. I got that 2 times. And your continual manual massage therapy has really been helping me too with my recovery.
So as an adjunctive therapy, the manual therapy, the massage, the trigger point therapy, fascia release, joint mobilization, the combination approach, you think it's been really helpful. How would you rate your pain now compared to then?
Well, it's going to be a little bit hard to believe, but at my worst, when I was really just confused and suffering and my pain receptors was just so high every day, I would be in bed for like 10 hours on my bed, right? And I was 265 pounds. I let myself really get out of whack.
Mm-hmm.
And I'm about 208 pounds, so I've lost maybe 50 plus pounds. And yeah, I'm getting lighter, I'm getting better, and I picture myself sitting at 175. So I still got some work to do, but with you by my side as like a really good healer and therapist for me, I feel like I can get there.
And what's your activity level like now? So at the time we met, you were spending 8 to 10 hours a day in bed because of the pain. And what's your activity level like now?
That's very true. So right now I'm getting my confidence back. So I would say I kind of train my body like 3 to 5 times a week, something like that. I'll do light cardio. I have a bike at my house that I use that's comfortable now. I'm not scared to go into a squat. There's so much stuff. I've done deadlifts again. Like, I do deadlifts. There's just so much things that I can do now, right? I really love going to the gym, and I love feeling good and releasing those endorphins. And now that I don't feel discomfort, I'm very happy that I'm able to train my body and get strong.
Yeah, Kevin, it's been great working with you and seeing your progress, both your progress and your pain and your mobility, and your progress with the weight gain and weight loss. It's been really illustrative for me to see how the techniques we learn in school, the things we study, putting it to action and seeing someone's life change because of it, seeing someone smile and seeing someone come out of that suffering phase. I think that's exactly why I started doing this kind of work. So I really appreciate you sharing a bit of your story. And if you have any final thoughts that you want to share, feel free.
Yo, thank you so much. I'm very honored to have met you. And you're more than a massage therapist to me. You're a great friend to me, and I'm very happy that we have a connection, you know? And that it's about community. It's about empowering one another. It's about teaching one another so we can get better together.
That's great.
Yeah.
Hey, what's up guys? I'm here at the Halsey Clinic. This is where I work now. This is where I practice osteopathy. And you know, the main reason I chose to start working here was, it was July of 2023. I started to get some serious low back pain. And I was like, who's the best chiropractor near me? And that's where I met Dr. Raf. And I came in for treatment, started getting some soft tissue, started getting some adjustments, started getting some chiropractic treatment on my low back. I started to get a lot better. Started to get my neck worked on, getting other parts of the body worked on. And I thought, I gotta work with this guy. I've seen 20 different chiropractors in the last 10 years. And I was just really impressed with his technique, really impressed with the results I was getting. I had done treatment plans before where I'm coming like twice a week and I just wasn't getting better. And so part of my pursuit of killing my own pain, Chris the Painkiller ended up collaborating with the Six Chiro, and that would be Dr. Raf. And so that's how I ended up found myself at Halsey Clinic, and you know, we kind of hit the ground running. Hey Raf, get in here.
Hey brother, what's going on?
Tell these guys how we met.
The day we met was probably one of the best days of my professional life. This guy came in as a patient. We had an instant connection. I asked him, what do you do? He's like, I'm a manual osteopath. I said, really? I said, well, where are you practicing? He's like, well, I'm not sure yet. So I kind of put that idea in his head to maybe come join us in the practice, and I can honestly say it's one of the best professional decisions I've ever made. He's one of the most amazing colleagues. Every time I have a patient that's not getting better, I'm thinking I gotta send him to Chris. And every time I send him to Chris, they're like, man, that guy's good. So that's how we met. I'm glad you're here.
So I was treating Lyndon as a registered massage therapist for 7 years before I did my manual osteopath license. And I wanted to quickly just go over some of the ways that my practice changed when I completed my manual osteopathy training. So a big focus that I've developed with him is getting each individual joint to move in the natural pattern that I would expect it to be able to move in. And the joints that aren't moving well or aren't moving to a kind of anatomical norms, I focus a little bit more on spending more time on those areas. But when I was a registered massage therapist, 95% of my treatment was muscle work and fascia work, doing trigger point therapy and myofascial release. Now I'm spending a lot more time using joint mobilization, using reciprocal inhibition, proprioceptive neuromuscular facilitative stretching, which is PNF stretching, muscle energy techniques. And so it's a more varied treatment approach. And I find that it's getting good results in terms of his movement and in terms of his pain levels. We're able to treat some of the joints in more thorough way, which allows his body to produce more synovial fluid as we're treating those joints and mobilizing those joints, which tends to provide more relief and more movement. And he's finding he's more flexible. He has an easier time moving after the treatments, and the effects of the treatment last longer than when I was doing trigger point and myofascial release alone.
Chris, why don't you tell the awesome people back home what we exactly do in this clinic?
So at this clinic, what we do is we have a multidisciplinary approach. We have fascia stretch therapists, we have Dr. Raphael, the chiropractor, we have physiotherapists and osteopathy, and we kind of join forces and combine our therapies. So a lot of patients come in, they'll get a quick fascia stretch and a little bit of soft tissue work and massage. Then they'll get some adjustments. Then they'll come in and have osteopathy in the same day, have some muscle energy techniques, some proprioceptive neuromuscular facilitative stretching, which is some good PNF action. We have a variety of modalities we offer. We use hydrocolators, we use ultrasound, heat packs, lasers, all kinds of manual therapy as the crux of everything. We focus on posture alignment. We focus on biomechanics and exercise. We focus a lot on gait and orthotics and getting people walking better, getting people out of foot pain, treating a lot of frozen shoulder, sciatica neuropathies. You know, ever since I put these spinal and cranial nerves up, I got more people coming and asking, oh, I got pain right here. Can you do anything about that? And things like that. You know, it's fantastic being able to combine the treatment with the physiotherapist and the chiropractor, just all different approaches. People are getting collaborative care. We discuss the patients. We kind of come up with the best plans, and people are getting the results they need. So it's kind of a pleasure to work here.
What's up, bro? It's been a long time. You know, Lyndon's one of my patients I've actually seen for maybe 7.5 years now. And he's one of the few patients that I was treating at the beginning of my massage therapy career. He saw me progress as a massage therapist, and he saw me change careers and go into manual osteopathy. And so he saw my skills develop and kind of evolve over time. One question I would have for him is, he's right in front of me, I'll ask right now, how do you see the evolution of manual practice? Like, how do you see my evolution as a therapist and the progression?
So, when I first found you at the spa, you kind of started on like, if we had like a scale on like kind of 1 to 10, you kind of started at like, like a 3 when I found you. You were pretty good, but you were better like than most of the other massage therapists that I had been through, especially with my whole history and things like that. But, you kind of like, let's say you were at a 3 and now you've jumped all the way up to the 9 and 10. You've progressed, throughout the years, and even when you were still a massage therapist, you were kind of getting up to like the 5 and the 6 area. And as you've kind of gotten to the osteopath and like the whole manual work and everything, you've progressed up to the 9 and the 10. In my opinion, I can't find anybody else that does the same type of work, not easily.
When you've seen other therapists, what are they doing differently that you find isn't as effective, considering that you have psoriatic arthritis and ankylosing spondylitis? Like, what are the other therapists, manual therapists, osteopath, massage therapists that you've seen? What are they doing differently?
Well, they're not really, I don't know how to really explain it. They're not really spending the time to assess as thoroughly as you are. When you kind of start off your sessions, you're always doing the assessment from like kind of head to toe, right? Like you're kind of feeling out all the different areas, and you kind of know just from touching certain areas, like, hey, these are the areas that you want to work on, you want to focus and zoom in on. I find the other ones, they kind of have just like a flow. They say, okay, I'm going to start from here, and then we're just going to move down, even though there's a problem area, and say, like, let's say my shoulder, or like that big knot or whatever, they're going to move past that. They're only going to spend a couple, a minute or two on trigger pointing and things like that, and then they're going to move to the next area without getting nearly as much of a response or a feedback from me, right? They're kind of just moving on to the next part. So with you kind of focus in, you better techniques, like, I don't know if it's those guys, like might be like their last patient of the day, or maybe early in the morning, I don't know, but they're just not putting as much effort in per se.
I think it makes sense sometimes when a new therapist, whether they're a new osteopath or a new massage therapist, I think it makes sense that sometimes they follow a routine, or like they have like a pre-planned kind of, okay, I'm going to do like 2 minutes here, 5 minutes here, 5 minutes here. And that's never been something that I've done. I've always found that just kind of doing an assessment and then intuitively kind of matching the science and the art of the practice, kind of going with a more evidence-based assessment, and then a little bit more of an intuitive palpation, and then combining those kind of like the beginning of the treatment is kind of like data gathering. I'm trying to see, like, put myself in your shoes, see how does it feel to be in your shoes, and what can I do to help? And then I just kind of execute my treatment based on not, like, I kind of go technique to technique, area to area, and just try to solve whatever problems I can. But I've never been much of a formula person, or much of like routine person. And so that kind of makes sense that a lot of new therapists, they start off with a routine, and it can be hard to branch out from that.
And like one of the big differences, even at the spa, you were asking me before I would lay down on the table, what do you feel today, and things like that, and what areas, would actually stand out more. And, I guess not every massage therapist actually does that in a way, you know what I mean? They don't really get the interview. They kind of, most of the time you get led to the room, boom, and then they kind of come in and, you know what I mean, they do their...
And they're sometimes in a rush to get you on the table.
Exactly.
And it can be that some therapists don't feel comfortable doing assessments. They feel like the patient might not feel like they're getting the perceived value, because they feel like, oh, I booked a massage, I didn't book physio, why are you testing this and that? Not realizing that little bit of testing we do impacts the treatment and helps us get a better outcome long term.
Yeah.
And I guess that's kind of the difference when someone's coming for a massage for pain management compared to when they're coming for a massage just to relax and unwind and have a tension releasing massage. It's a little bit different. When someone's coming for pain management, they want kind of a long-term progression. They want to get better over time. They're not just coming for a one-off massage just to relax.
Especially
And-
for someone like me who's motor vehicle accident, right? Which is how I even got into this whole massage kind of boat. Is, you get into the accident, they give you the $3,500 as a massage, you kind of go around, find the massage therapist, you go to clinics, you go everywhere, and eventually you kind of run out of that money, right? So then you keep going around to try and find massage in the same therapy in areas that aren't in the clinical setting, right? And I guess for you, you just happened to be in there, and I was able to, like, for you, it really just seemed like you cared, and that's what stuck more. And as I kind of kept coming more and more to you, and then I started to see the progressions, right? You started to test new things. You started to, like you said, you could stretch me out a little bit, things like that, and that was a big difference. It was a big difference compared to everybody else.
Man, that's great to hear. I appreciate it. Thank you for taking the time out. It's great to hear kind of the patient perspective and kind of get a little bit of a deeper thought into the perspective of someone who's going through the therapy, getting pain relief therapies. I really appreciate you taking the time. And yeah, thank you, brother.
Absolutely, man.
It's been a pleasure working with you.
Raf, how is it different working with an RMT compared to working with an osteopath?
Honestly, I love RMTs. I love you as an osteopath, but the great thing about Chris is that he's had 10 years, a decade worth of experience as an RMT, and he brings that into his osteopathic practice. So in this clinic, really it's a collaboration, because our goal is, if we can't fix you, there's someone in the clinic that can. So that's what I love about Chris. He knows what he's doing. So when I refer patients to osteopathy, there are a lot of them like, what is that? So I say, listen, there's a massage therapy profession, there's chiropractic. Osteopathy is kind of like in the middle. It bridges the gap between the two. And the great thing about Chris, he's got 10 years of experience as an RMT, so that's why it makes him even better as a practitioner.
You seem nervous. Are you nervous?
I don't feel nervous. I feel more scattered, I guess. But I think that's fine.
Absolutely. Thanks for doing this. I'm looking forward to seeing more of what's going to come.
Me too.